Good evening, everyone. I'm going to call this City of Menasha Administration Committee meeting to order. Clerk Galeazzi, could we have roll call, please?
Alderman Langdon.
Here.
Alderman Keehan.
Here.
Alderman Zielinski. Here. Alderman Spencer. Here. Alderman Benner. Here. Alderman Nichols.
Here.
Alderman Krautkramer.
Here.
Alderman Taylor has been excused.
Thank you. The first item of business is minutes to approve from the Administration Committee meeting of 9/21/15. Do we have a motion? Alderman Keehan.
Thank you. I'll make a motion to approve the minutes of the Administration Committee of 9/21/15.
Do we have a second? Second. We have a motion and a second. Any discussion on those? Seeing none, all in favor signify by saying aye. Aye. Opposed? Minutes are approved. First action item this evening is the Joint Powers Agreement Winnebago County Emergency 911 System for December 1st, 2015 to November 30th, 2016. Chief Oxher isn't here. I guess I'll defer to Chief Steica on that.
Yep, we use the same 911 system. This is the same agreement that the Council and the Admin Committee has had in past years because the 911 Command Center is down in Oshkosh, run by Winnebago County. This is the agreement that says that they're going to run those services for the police and fire and EMS services.
And it's been my experience that these are pretty straightforward. The only thing that changes really are the dates.
Yep, the only thing that's changed is the date.
Great, thank you. Do we have a motion? Alderman Keehan.
Thank you. I will make a motion to forward to the Council the Joint Powers Agreement for Winnebago County Emergency 911 System for the term of December 1, 2015 to November 30, 2016.
We have a motion and a second. Any discussion? Seeing none, we'll take a roll call vote.
Motion carried on roll call 7-0.
Next item of business is the request to apply, receive, and spend a National Council on Aging Mastery Program grant with the Neenah Menasha YMCA. Director McKenney, could you tell us a little bit about this, please?
Sure, thank you. This is a new grant that we want to apply for with the YMCA, Neenah Menasha YMCA. The grant would help our older adults with key areas in their life. Basically, it would we'd apply for $12,000 and $4,800 in program materials from the National Council on Aging. The Aging Mastery Program is well known across the country. It's got 124 sites across the country. This one is specifically for rural communities. We're ideally situated to receive it because we have a senior center, and we also have a good collaboration, a strong collaboration already. We would have the funding to be made available for a 10 module curriculum. The curriculum basically is for exercise, sleep, healthy eating patterns, and hydration, financial fitness, advanced planning, healthy relationships, medication management, community engagement, and falls prevention. So we're actually seeking your approval to not only apply, but to receive it and spend it. And this would, we'd apply by November 13th. We'd be notified by December 31st if we're successful, and we would be able to undertake the grant in 2016.
Great, thank you, Director McKenney. There is a recommendation on the bottom of Director McKenney's memo. Do we have a motion? Alderman Keehan.
This gets forwarded to the Council. I will make a motion to forward to the Council the request to apply, receive, and spend the National Council on Aging Mastery Program grant with the Neenah Menasha YMCA.
We have a motion and a second. Attorney Captain, is it important to have the amounts in that motion, the dollar amounts? Alderman Keehan?
For the grant total of $12,000 and $4,800 in program materials.
And do you follow with the second? Thank you. So we have a motion and a second. Is there any other discussion? Great, seeing none, we'll take a roll call vote.
Motion carried on roll call 7-0.
And the last item of business this evening is the 2016 Health, Dental, and Vision Insurances, and I'm going to turn this over to Director Stino.
Okay, the first memo you have is on health insurance for 2016. If you recall, we do have a 2-year agreement with Wisconsin Counties Association Group Health Trust. There was a set of 2015 rates which are attached and a not to exceed guarantee of 8% in 2016. After some discussions with WCA Group Health Trust, we are at a 5.5% increase. If we're willing to make a couple plan design changes, we can get down to a 2.5% increase. The plan design changes are few, but they're at the bottom page of the first page and the top of the second page. The first one would be the city agreeing to participate in a local clinic. So basically what happens is our health provider, WCA Group Health Trust, creates a clinic, and in this case it would be a joint clinic with Menasha School District because they have the insurance as well. In fact, they're already on the way to setting the clinic up. It would not be a requirement for our staff to go there or their families, but it would save them money if they chose to. For example, they might have a nurse practitioner with a couple other nurses, etc. If you have an earache, you might choose to go there as opposed to urgent care where you'd get the same kind of treatment. The difference between doing that and going to one of the actual clinics is you don't have to pay anything if you're a member of our plan to go to that provider, where you could go, in the example with the earache, it could be like $275 until your deductible is met. So I did attach a flyer from a similar clinic that's already in place in the Oshkosh area with some of those employers. Seems to be working very well. They do try to cater the hours around when it's convenient for our employees and their families to go. And like I said, it's a cost-saving measure on their part, but because the plan also gets cost savings, that's the reason for the 2% premium reduction. The next premium reduction we're recommending is the addition of a $100 copay for high-tech imaging. That would include MRIs, CAT scans, and PET scans. As we looked at the plan, this was something with current usage that we thought would be a prudent business decision to make for the city. There is another flyer included in the packet, which is the last one, that would knock that $100 deductible down to $50 each time, or I'm sorry, copay down to $50 each time if the patient, the member went to Smart Choice MRI as opposed to going to a hospital. You can see on that flyer the difference between those services depending on where they're obtained. The other addition or the change that we have, no cost or reduction, would just be the addition of a health club reimbursement, $120 for somebody on a single plan, $240 for somebody on a family plan. And again, WCA Group Health Trust is very strong on wellness, and this is part of that initiative. In addition to that, we would continue on with our health risk assessment biometrics testing funded by the plan, as well as a wellness grant and the fact that they take care of all of our ACA. That's the first part of the recommendation. The second part of the recommendation is to add a premium contribution of 2.5% for all non-represented employees. I don't have a lot of history here, but prior to me being here in 2013, I understand there used to be a premium sharing of 10%. That was when there was a much more traditional plan and the deductibles and out-of-pockets were much, much smaller. Currently we have a $1,500, $3,000. However, we did agree with our police representatives that they would go to a 2.5% premium share as of 2016, and we think it would be best for everybody in the city to go on the same path. I understand that 2.5% doesn't sound like a lot to a lot of people, but when you look at the changes over time, with all of the changes in the state law, the employees really have taken a cut in take-home pay every single year from 2011, which would have been the high point, down to through 2014, and just in 2015 they're starting to recoup that. A 2.5% increase, our premium contribution, would be about the equivalent for an average employee of about a 1% wage increase. So that's our recommendation. Again, in the future, we can certainly build from there, but we wanted to get that premium contribution reestablished, and the mayor believes it's very important, as do I, for all of the staff to be on the same page as far as where that's at.
Thank you, Director Stino. I'm going to allow for questions on this particular item before we actually have a motion. Does anyone have any questions for Director Stino on the health insurance proposal? Seeing none, then we'll look for a motion. There is requested action on the bottom of page 2 of Director Stino's memo. Alderman Keehan?
Thank you. I'll make a motion to forward to the council approval of the following as it pertains to our agreement with Wisconsin Counties Association Group Health Trust. Plan design changes, participation to include participation in the local clinic, addition of a $100 copay for high-tech imaging, and addition of a health club reimbursement benefit of $120 for a single plan or $240 for a family, and a premium contribution of 2.5% by all non-represented employees.
And do we have a second? Thank you. We have a motion and a second. Are there any other questions or discussion? Great. Seeing none, we'll take a, oh, I'm sorry. Yeah, we'll take a roll call vote.
Motion carried on roll call 7-1.
Thank you. And then the only other thing, my pause there was the information on the dental and vision insurances that Director Stino would like to pass along.
Yep. And that's just, the second memo is just an FYI. We are self-funded for dental. The most recent 12-month period, you can see an analysis that we prepared as far as showing you where we're at with that dental fund. We do not recommend any kind of an increase for 2016. And then for dental, for vision, we are on a 3-year agreement. The 2016 will be the 3rd year of that agreement, so there will be no change on that as well. So this is just an FYI.
Thank you. Any questions on that? Great. Seeing none, we'll have a motion to adjourn. We have a motion and a second. All in favor? We are adjourned.